Why are kids still dying in the United States when we have the root cause analysis shows that they're 100% avoidable and preventable? And the reason is it's complicated. So it's hard to understand all of this. This audience knows all of this. So how many of you have children with asthma? How many of you have worried about your children possibly dying at some point? Me too. I was in the code room of the ED twice with my youngest, wondering whether they were going to live or not. And that makes a difference. So one of the things we want to talk about in trying to have a value-based payment system eventually is value. What is value? There's three different kinds of value. When I'm in the ED looking to see whether my child is going to die or not, I don't care how much it costs. I don't care who's going to pay for it. I want them saved, and that's the social case. So the economic case is basically how many of you out there think that we can do better with better outcomes and lower cost? That's the economic case. So the benefits outweigh the costs. How many of you out there think that there may be barriers that may prevent you from doing that for your organization and doing your thing? All right, that's the business case. That's your own perspective from a stakeholder perspective, and that's part of the issue and complexity that we have is all the different stakeholders involved in this. And to really address asthma, every single one of them has to be at the table, engaged, and have their own business case met. And so we're going to be focusing on the one at the bottom, the health plans today, but really at the table it has to be everybody. So let's look at finding a common ground. In trying to understand the stakeholder viewpoints, each of us can have various hats. Of the 8 that were up there before, I've got about 6 of them because we work with so many different organizations. Each of you can too, and it's looking at the problem through each other's eyes will really help. And so the title of our talk in the program was Finding Reimbursement. Well, reimbursement is current state. That's the state that's designed by regulatory and payment silos. And part of what we want to be thinking about as we look forward is the future state where we can plan together. And where that's of value is because that can take us out of our restrictive silo back up to the economic case, which we all pretty much agreed there's an opportunity there. But as part of doing that, we still have to get each of the stakeholders have benefits greater than cost. And so what value-based payment models can do is take that braided funding mechanism that Amisha spoke to earlier and make it real by having all of us sit at the table, understand where each one is coming from, and help sort of plug the gaps. Well, I've got more benefit than I have cost, so I'll be willing to take on more of the investment because I know it's going to be worthwhile for me. And here I have too much cost and not enough benefit, so here's some of the costs that I need to redistribute, maybe to some of the players like employers and us as consumers and parents and so on. And that's part of what the programs you've heard about are looking to do. And so how do we go about doing that? Oops. Yeah. Okay. From a plan perspective, they're the easiest because most of the viewpoints are evidence-based. We can measure costs, we can measure benefits, and so on. And so what we really want to be able to do is utilize that braided funding and achieve the better outcomes, better outcomes, better outcomes, better outcomes.